Hi, my name is Kerrigan Casey. I'm an Arkansas Tech nursing student, and I'm going to be performing a head-to-toe assessment on you today. Um, I'm just going to ask that you verify your name and birth date.
Chloe Jackson, 8/28/68.
Okay, thank you. And I'm just going to start off by asking you a few questions.
Okay.
Excuse me. So the first one, who's the president?
Joe Biden,
Where are we?
Greenwood, Arkansas,
And what day of the week is it?
Sunday.
Thank you. Next, I'm just going to be taking a look at your scalp. I'm just going to be assessing for any abrasions or any red spots or things to be concerned about, and I don't see anything. Everything looks good there. So now I'm going to be assessing your face. I'm going to start off by doing cranial nerve 7, and that just tests for smile. So if you'll smile for me, frown, puff out your cheeks, and raise your eyebrows. Good. And now I'm going to be testing cranial nerve 5, and that just tests for senses. So I'm just going to rub this across your face like that and let me know when you feel it. Okay.
Right, left, chin.
Okay, thank you. And next I'm going to move on to your eyes, and I'm going to start off by testing for your pupils. So if you'll go ahead and turn the light off, please. And back on. And now I'm going to be pulling down and looking at your conjunctiva. And they both look good. And also your eyes overall look good. There's no drainage, no redness, nothing like that. Now I'm going to be performing a diagnostic test. And I'm just going to put my finger in directions and just follow with your eyes and not your head. Good, and that tests your cranial nerves 3, 4, and 6. And then I'm going to be testing for Perla. So I'm going to start off by doing accommodation. So if you'll just follow my finger. Good. And now I'm going to be testing your red reflexes. So if you'll just focus behind me on that door. Good. So that's everything for eyes. And moving on to nose. I'm just going to be inspecting. There's nothing concerning on the outside. Everything looks symmetrical. Excuse me. And now I'm going to test your nasal passageway and your sinuses. So if you'll just occlude one nostril and blow in and out. And do that for the other side. Good. And now I'm going to palpate your maxillary and parietal sinus. And then I'm going to go ahead and take a look at your mucous membranes if you'll tilt your head back. And everything looks good there. There's no scabs, redness, perforated septum. Everything looks good. I'm going to move on to your ears. And I'm just going to be inspecting both of them on the outside first. Look at the tragus, maxillary, pinna. Everything looks good there. I'm going to go ahead and palpate as well. Good. And then I'm going to get my otoscope, sorry, and flip it and be looking inside And there's no drainage or redness or scarring of the tympanic membrane, so that's good. That side looks good as well. And now I'm going to cover my mouth and whisper a word, and I'm just going to have you repeat it back to me.
Ivy. Thanksgiving.
Good. Everything looks good there. I'm going to move on to mouth. So I'm just looking right now at the outside, looking at the lips. They look pink. There's no bluish color, nothing like that. I'm going to have you smile. I'm going to look at your gums. I'm going to pull down. And they look pink, moist, nothing concerning there. Good. I'm going to have you open your mouth. And I'm going to be looking at your tongue, looking in the back of your mouth, at your uvula. Everything looks good. And while you have your mouth open, I want you to say "ah," and I'm just going to be testing your gag reflex and cranial nerve 9. Good. Good reflex. Now I'm going to be assessing your neck. We'll move on to neck, and I'm looking right now, and I don't see anything concerning on the outside of the neck. I'm going to go ahead and palpate. I'm going to start with the preauricle lymph node, post-auricle lymph node, deep cervical, superficial, and then we have submandibular, and submental. And then if you'll shrug your shoulders, clavicular, and then tonsillar. Okay. And now I'm gonna have you test range of motion. So if you'll go ahead and look to the left for me, and the right, and then up and down. Good. And now I'm going to move on to your heart. And I'm going to start off by locating your PMI, which is at the 4th and 5th intercostal space, mid-clavicular line. So I'm going to have you go ahead and lay on your left side. And I'm going to listen to that first. Okay, good. And then if you'll set up, and I'm gonna listen to your apical, and this is supposed to be listened to for 1 minute. And that is supposed to be anywhere from 60 to 100 for the rhythm. Everything sounded good there. Sorry, I'm also gonna listen to your aortic, your pulmonic, herbs, tricuspid, and mitral. Good. And now I'm going to be, I guess we can move on to lungs. I'm gonna start off with the lungs by just looking at your breath. So if you'll breathe in and out. Okay, everything looks good there. I'm gonna start off by listening to 5 spots on the front. So if you just take a breath, deep breath in and out. Everything sounds good there, and if you'll just turn around and I'm gonna listen to the 9 spots on the back. If you'll take a breath in and out. Okay, good. There were no abnormal noises heard, crackles, wheezes, nothing like that. I'm also gonna test your APT, so 2 to 1, so that's good, equal there. I'm also going to assess your T9 and T10 symmetry, so if you will just take a deep breath in and out. Good, everything went back there, good. And now while I'm back here, I'm also going to test your CVA, so I'm just gonna place my hand right here and let me know if you feel any pain. I'm gonna do it on that side too. Good. And also, I'm gonna go ahead and do your carotids before I move on to your abdomen. So I'm gonna listen, well, I'm gonna first palpate. A good 2+ there. Now this side. Good, and I'm gonna listen with my bell. I'll move to this side. Everything sounds good there. I'm gonna move on to your abdomen. So if you'll lay down for me. I'm gonna lift your shirt up and inspect. And everything looks good. Symmetrical, there's no redness. Nothing to be concerned about there. And then I'm gonna go ahead and listen to your bowel sounds. My diaphragm. Okay, good. Heard some bowel sounds. And now I'm gonna go ahead and palpate. I'm gonna do superficial first and then deep, and just let me know if you feel any pain. feel anything? Okay. I'm gonna do deep now, so this will be a little harder. And this is just testing for nodules. Any pain with those? No? Okay. And now I'm gonna test for rebound tenderness. So I'm gonna be pressing down on the right side. And when I let up, let me know if you feel any pain on the left. Sorry.
Okay. Good.
Okay. So go ahead and set up for me. And now I'm gonna move on to your upper extremities. I'm gonna be just assessing the texture, and it feels warm, pink. Everything looks good on that side. Looks and feels good on this side. There's no lesions, abrasions, scratches, nothing like that. I'm gonna go ahead and assess your capillary refill on both sides. And it came back in less than a second, so that's really good. And good for that side as well. I'm also gonna test your range of motion. So if you'll start off by just moving your shoulders back and forth, raising your arms or extending them out. Good. And then if you'll go ahead and flex and extend. Good. And then I'm gonna test your strength. So yes, if you'll keep your arms like that and don't let me pull. Good, and don't let me push. Good. And I'm also gonna have you hold your arms out like this and don't let me push or pull this way either. Good. And now I'm gonna move on to lower extremities. So if you'll go ahead and do the same, put your feet out. And I'm just gonna be looking at the legs, even hair distribution, no redness or scratching, scarring. Everything looks good there. Also temperature feels warm, skin is pink. I'm gonna go ahead and test for edema. Everything feels good, as well as the feet. And since you have no polish on for capillary refill, I'm just gonna be looking at the bottoms of your feet. And the refill is within 1 to 2 seconds, so that's good there. I'm gonna go ahead and test for range of motion with the legs. Or strength, I'm sorry. So if you'll push down, good. And then don't let me push down. Good. And I'm gonna do that for the feet as well. So press down. And then don't let me press down. Good. I'm gonna test for range of motion as well. So if you'll start with the feet and just move your feet in a circle. Good. And if you'll just move your feet down and up. Good. And if you'll do that for your legs as well. And if you'll move them up. And then I'm gonna have you assess gait. So if you'll choose a leg and move your heel up to your knee. Good. Good, thank you. And now I'm gonna also be testing your senses on your foot. So I'm just gonna take this key, and if you'll close your eyes, tell me when you feel it. Okay. And then I'm gonna be checking for your pulses and your tibular. And then in your dorsal. And the feet ones are always the hardest to find. Okay, good. Also, with pulses, gonna go ahead and check your brachial and radial pulse. So I'm gonna start off with brachial. I'm at radial pulse, I'm sorry. Good, 2+ there. I'm gonna go ahead and assess it on this side again. And I got 2+ there. Okay, good. And I think that completes our assessment. Thank you.
Thank you.